day. And tobacco has created a lot of challenges in the lifestyle disorders and challenges in the medical side for a very, very long time. And to discuss the medical as well as the social side of the challenges of tobacco, whether it is through smoking or chewing tobacco, we have with us four specialists. We have with us Dr. M.S. Dover, who is the Senior Consultant and HOD for Respiratory Medicine, Critical Care, Sleep Disorders at Apollo Hospital, New Delhi. We are also joined with Dr. Satyanarayan Mysore, who is the HOD and Consultant Pulmonology, specializes in lung transplant at the Manipal Hospital, Bangalore. We have with us Dr. Gaurav Gupta, who is a reputed senior psychiatrist in Delhi. He's the CEO and co-founder of Tulsi Healthcare, a psychiatric hospital that is dealing with rehabilitation facility for patients suffering from substance abuse, bipolar disorder, and other mental diseases. We also will be joined by Dr. Anushil Munshi, who is the HOD and consultant radiation oncology at the Manipal Hospital, Delhi. Dr. Gaurav, let me begin with you. First thing first, why do people take up smoking? Where does it start?
So good evening, everybody. And it's pleasure to be on this platform and as my contribution towards a No Tobacco Day. So smoking is becoming a very prevalent habit. And if we see, we all kind of tried it during the 10th to 12th or early college days out of either inquisitiveness or some hero role modeling, or somewhere we got tempted to try. Now, definitely the problem with the nicotine is it causes immediate relief in our anxiety, gives a feeling of a rush. And so it's a very habit-forming habit. So it starts early adolescent or in the adulthood, and gradually it becomes part of our habit. Gradually, see, the other problem what I see is that in society it's very commonly available at a very small price. You see a poor also a smoker, a rich also a smoker. If you go to party, you see a lot of them smoking it. These days, youngsters with tobacco is also mixing marijuana with it. So it's becoming very prevalent. And nowadays, the newer trend is that women are also becoming quite few smoker. So which used to be rare and used to be confined to a very lower kind of a class where there used to be bidi smoker females. But these days, if we go in educated society, go and see the colleges, there are a lot of women who are also started smoking.
Dr. Kumar, you must be meeting a lot of people who come with respiratory problems who are smokers, right? I want to understand, like Dr. Gaurav said, that you see women who are now smoking. Has this suddenly increased, or is it just becoming more visible today that we see more women smokers than ever before?
They found that they take smoking as a result of depression or stress, or depression stress. So that is the reason that in the show, the these are available in India, for example.
Dr. Kumar, sorry, your voice is cracking. Your voice is cracking. I think you'll have to reset your audio. Can I? Yeah. Can I?
Keen to do that. Yeah.
Yeah. Yes, Dr. Kumar.
Okay, all right. So in individual in India, for example, the young boys, let's say from 18 years to 30 age, the commonest reasons are actually the uh, getting pressure as well as a feeling of being cool about taking to be a part of a party atmosphere, like my colleague just said. So some of them even act as a rebel against their parents or the school, the teachers, when they are not able to cope up with the pressure. That is another reason is they start the smoking, to begin with. So peer pressure and stress are very, very common. And in ladies, the same is true. And as it's just been told, the numbers in ladies, the women, young women, has gone up tremendously. It's not just the poorer class, which used to be the case in the past. It is now among not only rich class, but middle class young girls taking to smoking and cool and peer pressure. That is the common reason. And that's what, and the numbers in ladies and females has certainly gone up, irrespective of the fact that they know, or they have been made to know through advertisements, through the media, through the literature and the Google, what the side effects are, what organs are involved, reproductive organs are involved in that, and what cancers and smoking related other diseases it can cause.
Right. Dr. Mysore, we know that tobacco causes harm to our body. Can you explain how does it harm our body, and in what ways is it creating a problem for what is going inside of us?
So if we were to imagine a magical drug that could not adversely but beneficially affect every part of the body, that would be something like nicotine, because it is all pervading. It affects every single organ in the body, as remote as urinary bladder to sexual function to adversely impacting diabetics. So most commonly we see lung injury in terms of bronchitis, worsening asthma, COPD, interstitial lung disease, all these kind of things is what we commonly hear. But the issue is that it affects virtually every single organ. Now there are number of mechanisms. The byproducts of the nicotine is all pervading. It will affect the microcapillaries. It will affect the bad lipids. It will affect the cardiac muscle function. It will inversely affect the sympathetic tone, that is the tone of the nervous system that regulates our cardiac function and flight and fear responses. So there is an undue stimulation of this sympathetic nervous system, neuronal stimulation, and many other things. And it does affect bladder, urinary bladder cancers, stomach and gastrointestinal issues, worsening pre-existing diseases like irritable bowel disease and inflammatory bowel disease, so on and so forth. So it may not be wrong to say smoking virtually affects every single function in the human body, from inflammation to cancer.
Dr. Mysore, I mean, since we brought up the issue about women taking up smoking lately, and it is becoming equally a problem. Earlier, it used to be associated with men, more so in the macho thing to be smoking. But is there any difference in the impact that it creates in the body between men and women?
May not be, but then we need to look at the physiological parameters. For example, the functional residual volume of the lung volume itself is slightly bigger in men compared to women. Therefore, when the same damage is inflicted, there is a disproportionate amount of lung damage. And this would be speculative and argumentative, but then I think if I have small lung, I should be more on the guard. So I think it causes much more deleterious effects, infertility in women. So many other things associated with women and smoking. So yes, it is topical.
Got it. Dr. Kaur, what is the incidence of cancer among smokers? I mean, what percentage of smokers actually end up having cancer? Do we have some numbers or figures or any estimate?
No, I can't give you on like that because it would depend on the number of cigarettes smoked, or let's say number of pack years. And there is a lot of genetic thing here. Some people are genetically more predisposed to have COPD, for example. So people would have much more incidence of tumors in their body. And so the same amount of cigarette smoking is not because well, but certainly it is. It's also interesting here that we used to believe some 30 years ago, when I took medicine and respiratory medicine some 45 years ago, there was a common belief that if you actually say goodbye to 10 years of not smoking at all. So that was debunked later on, and we tend to believe it.
So your audio device is not working properly. Is that me only who is facing this problem, or everybody is facing the same
issue?
Same issue.
Audio.
Okay. Dr. Kaur, we'll have to look at your audio, please.
All right. If you can still not hear me.
Now it's slightly better.
Okay. I'll say when you smoke 1 cigarette a day or you smoke 20 a day, the incidence of one cigarette smoker a day would be just, so let's say, would be in 20 pack years. It goes to show that once the stimulation and the stimulus to those carcinogens starts in the body, and the reactions take place through absorption of the smoke into the gut, into the blood, and everywhere in the body. Once that thing starts, it's not that ex-smokers would be not having a higher incidence of all those diseases. For example, COPD, lung cancer, coronary artery disease, brain stroke, reproductive defects in women, like low fertility, stillbirth, like premature babies, and other kinds of and cervical woman, liver, urinary bladder, pancreatic cancer, stomach cancer, they all go higher up as compared to normal people, the people who do not smoke. The cancer, of course, is the worst because the mortality risk is very high. It triggers bronchial asthma in a lot of patients. So it can start or worsen your diabetes type 2, blindness, macular degeneration, cataracts. There's so much into that. But your cancer incidence exactly, it will vary so much. And it would also vary in different populations, in different ethnic backgrounds.
Got it. Dr. Kaur, I request you to, have a better connectivity or something. Maybe you can shift your connection or something. Dr. Mysore, I'd like to bring this question to you as well. Dr. Kaur did mention that, apart from cancer, there are other ways in which smoking or tobacco consumption can actually affect you. Can you share with us what actually how it causes harm to lungs?
Yes, good question. So with the smoked nicotine particles at the smallest unit of the breathing unit in the lung called the air spaces or alveoli, it does indeed cause what we call as a direct damage, and over a period of time brings about a chain reaction. And there are two things here. There are digestive enzymes which are released into the air sacs from our own body to undo the damage, and these are called metalloproteinases, and they basically end up damaging, worsening the damage. And if you see, smoking rarely causes damage in the major airway. Otherwise, anybody lights up a cigarette, they just feel the discomfort and the pain and other things in the major airway. They would have thrown the cigarette. Now, the thing to realize with cigarette is it causes damage in the smallest of the small airway. And that would take 20, 30 years to become clinically very significant. So it's not uncommon. Patients do come to us and say, I gave up smoking 20 years ago. Doc, why are you bringing up smoking? Because that is exactly the time required for the damage to be complete to the smallest unit of the air sacs, and there are millions of that. And that will cause issues with our airway. So that is a direct injury. Then you have deleterious effects on the heart itself, which will indirectly compound the lung circulation. So number of direct and indirect ways in which it can affect the lung.
Got it. Dr. Kanwar, what I want to really ask you is that there was a mention of that, it impacts the production or the fertility in women. How does tobacco consumption, smoking or chewing tobacco can impact the sexual health of people, both in cases of men or women?
Well, it's through.
So we are still facing the audio issue. Dr. Mysore, would you want to take this question, please?
Yes. If you look at established literature, there is a study in the University of Texas by Maston and his colleagues. Also, a study in Lancet as late as 2015 September, Lancet Diabetes issue. If you look through both, they have looked at there is an inhibitory, that means bringing down the sexual response in both men and women. Also, at the same time, it will affect the microcapillary circulation, causing perturbances in the blood flow in those genital organs as well. There is also a hindrance in the sperm concentration and the movement of sperm. Therefore, there is a myriad ways in which it can bring down the sexual health, it can bring down the fertility down. And most of it, there are well-established studies, and in the coming years, we will see much more brighter meta-analysis, which are hierarchically much better placed evidences coming into picture.
So does it also impact the pregnancy among women?
Yes,
it does.
So we have the studies, very good studies from the South Australian and Perth women's study, which looked into impact of women who refuse to quit smoking on the pregnancy and their own health during pregnancy, because during pregnancy the breathing reserves are stretched and challenged, and smoking does play a very pivotally damaging role.
So since we're talking of pregnancy issues, as well as women who are pregnant and continue to smoke, how does it in fact impact the child to be born?
Yes, there are some studies pointing out to intrauterine growth retardation, low birth weight, and lactation responses being not optimal. But I think our country is still a bit on the conservative note compared to the West. So therefore, the incidence of smoking in pregnancy could be very low. That's my guess. That is because the Indianness in everyone. Women would tend to, care a lot about their pregnancy outcome and probably would not do so in large numbers. There will be stray numbers.
Sir, Dr. Kanwar, if you are able to join a better connection, my question to you is that how does smoking impact diabetes patients? Especially, I believe that, type 2 diabetes it affects. And if this is true, how does it affect the diabetic patients? I guess the challenge on the audio side is still there.
Maybe I can take up the question if you don't mind.
Yes, absolutely, Doctor.
So, as I was bringing up the Lancet article, Lancet Diabetes Mellitus article 2015, September issue, not a big study, but definitively something that conclusively brought out few issues. The smoking will lead to increase in triglyceride and the smallest circulation getting affected, microcapillary as we say. In diabetes, one of the crux of the problem is the sorbitol, that is the product that can't get metabolized further, actually irritates the blood vessels. And that is why we see strokes, atherosclerosis, that is hardening of the blood vessels. All these things do happen to a very great extent in diabetes. So basically what smoking does in diabetes is to provide a lot of impetus to the deleterious effect of the already existing deleterious effect of the diabetes. So it's a double whammy, if you would like to call that way.
Yeah.
And it will potentiate and bring in what we call as insulin resistance. That is, I am producing good amount of insulin maybe, but that cannot reach the action sites in my muscles because the smoking interferes and creates a less of a bondage between the acting site and the hormone.
Got it. Dr. Gaurav, let me come to you. That once the smokers realize and they wish to quit smoking, what is the help that is available to them?
See, basically quitting of any habit, and especially something which is so addicting, is always been a big challenge. Now, the problem is also that we go through a lot of stress and up and down of the day, and our lot of habits and hobbies are connected with the smoking. Like a lot of patients who are trying to quit, they say they can't go to the loo or they can't pass motion without smoking. Or somebody who is drinking a lot of tea or coffee, they associate smoking with tea and coffee. Now, so basically the mostly a smoking treatment should be a more like a OPD treatment where we try to first encourage them, motivate them and see their motivation to quit. The second is their psychological inclination to face the reality or difficulties they are likely to face. And then there are some medications which are useful. There are also some alternative therapy which are proven to be very effective. Like there are some acupuncture which is found to be effective. There are some laser therapies which are reducing your craving for cigarettes. As well as there are two medications which are very commonly used. One is bupropion and that is second is the Vernaxin. These two medicines are very commonly used to help somebody to quit smoking. Now, this is a more like a short-term plan. The biggest difficulty in smoking is the long-term plan. There are very high chances of restarting, and relapse rate is quite a lot. They stop, but they start. Like following a heart attack, a lot of them quit for 6 weeks, 12 weeks, 6 months. But as soon as they settle down, they get immense craving and they start again. Similarly, in diabetes, when somebody is having the complication with diabetes, they stop. Or women during the pregnancy stop. While as soon as things are settled down, they immediately revert back to the smoking again. Now, these things are becoming very prevalent and relapse rate is very high, and that is a bothersome thing. As Sir has discussed, Dr. Masood has discussed, Dr. Kanwar has discussed, see the smoking, there is one is immediate impact, but the another is a long-term impact. Now, even if you quit and you get this kind of a feeling that it will keep affecting you, that is very disheartening. And a lot of them say, if it is already damaged our system, then what's the point of stopping? So definitely the damage it caused cannot be reverted back, but definitely we can reduce the progression of those damages. And definitely there are health conditions where we should definitely stop smoking, like asthma, like diabetes, like heart diseases, like cancer. And there we have to completely stop smoking. That is necessary not only to recurrence of disease, but also prognosis and progression of disease. There are very few cases where we found that admitting them in a hospital or rehabilitation facilities are of help. Definitely in India, there are a lot of faith healers and a lot of gurus which are equally playing a lot of role where they encourage no tobacco or no smoking thing. Now, I see a lot of persons or the ones who are smoking, they go and visit for 5 days camps or they go to temple, and they are able to give up smoking much more easily because psychologically they are very inclined and they see that there is nobody smoking and they encourage and get motivated. So I have covered the medical approach, I have covered rehabilitative approach and alternative therapy approach. These are the three commonly used approaches which are found to be effective. The only downside is that relapse rate is very high. So somewhere we have to encourage them to keep them engaged into the program on long-term basis.
Dr. Gaurav, one of the things, we have just touched upon somebody who's addicted to smoking, and we're talking about what is the help that is available to them. The fortunate thing is that the education that is being done or the efforts by the government being done to let people be aware that this is harmful is quite extensive. Even the cigarette packs, they have this huge warning on that. And people who take up to smoking are well aware of the challenges. But they start with taking up smoking as a casual habit that, chalta hai, I know I'm not going to get addicted, I'm not taking too much. But there's a very thin line very soon that they cross and they realize that they're already addicted now. What is it that we can do to help people prevent the addiction? So when they take up the casual smoking, what is it that they can do so that they don't get into the addiction in the first place?
See, Mr. Narula, the biggest challenge here is that what government is doing is making us aware about the ultimate complications. They are not helping us how we can stop starting or how we can not introduce ourselves with the ever exposing ourselves with the cigarettes or nicotine. So see, the awareness is created about the extreme like lung cancer, like oral cavity cancers, like heart attack, like which is they don't see immediately coming. if I see all the addiction, the biggest problem is they are very slow to impact your body. See, if you smoke today, you will see the impact of that maybe few years down the line. Now they say, now especially somebody like us who are living in Delhi, every day we keep reading a lot of these articles that everyone is smoking one packet of cigarette every day. Now, if we are smoking one packet of cigarette every day, they say if we smoke 5 cigarettes extra, what's the difference it is going to make? Now already our lungs or bodies are getting damaged. So I would say that the initiation of this awareness has to be started at very early childhood. And that's how it is going to make a lot of difference. Now, if we see in West, the smoking is reducing. The percentage of population which is in smoking is coming down. And what they have tried doing is that they have started involving school students and college students into many programs which are anti-smoking kind of a campaign. They create a awareness at that level that, see, your right example is not somebody who is smoking, rather the right example is who is not smoking. But you see the counter side. These days, the marijuana is becoming much more prevalent in the school or the early college days. So what they are doing, they are shifting from nicotine to marijuana. And if I see in my practice, I see a lot of young kids, even 13, 14-year-old kid coming with the marijuana exposure. So one side is we are helping them to not smoke, but other side is they are not smoking nicotine, but they are abusing marijuana as an alternative. So definitely creating a more awareness, giving them a better, less stressful life is a much better option where we have to create a long-term campaign.
Got it. We are also joined by Dr. Anushil. Dr. Anushil, welcome to VW Healthcare. Thank you so much for joining us. My question to you is that tobacco consumption is always or mostly related to smoking. But in India, we see a lot of tobacco chewing that happens. And what are the medical challenges that chewing of tobacco can cause? And are they any different from smoking?
That's a very important question. I'm sorry for being late. So this smokeless tobacco, as you rightly pointed out, it's a big challenge in the entire Southeast Asian region, including India. And in India, actually, the consumption of this is almost twice that of form of smoking kind of thing. So it's around 20% of the population which is using this smokeless versions of tobacco, which could be canny, it could be gutka, it could be a combination of lime and so many other things. Now, these things actually can have very high levels of nicotine. And this is a very addicting kind of a substance, even sometimes higher levels than cigarettes. So, and then the other problem is it's hitting maximum the poorer of the poorest. So it's hitting that kind of a population the most. And that's why it poses really, really significant challenges. It can cause n number of problems, including, of course, starting from some fibrosis of the mouth and some other changes in the dental hygiene, and then going on to serious things such as oral cancers or upper esophageal cancers or throat cancers and so on and so forth. So it could pose n number of problems, and it affects a vast majority of population because they are using this form of tobacco.
Sir, I'm glad you brought up oral cancer as one of the things, because I see a lot of dentists. I'm in fact married to a dentist, and she gets a lot of these cases of tobacco chewers. Now, is oral cancer curable? That's one. And second is that can it lead also to fatality, and what is the kind of life that the person would be leading if the person has oral cancer?
So as a direct consequence of this kind of tobacco use, the smokeless tobacco use, oral cancers are disproportionately high in countries such as India compared to the world population. And that is why it poses quite a few challenges. Now, worldwide, there are no fixed norms for kind of, for example, screening for oral malignancies. But doctors such as dental surgeons, as you rightly pointed out, they are in a unique position to detect while they are doing the dental work. They are in a unique position to detect these malignancies as well while they are doing the oral examination. Now, talking about cure, as is true for most of the malignancies, oral malignancies also, if they are detected early, very small T1 malignancies, they are highly, highly amenable to cure. The problem is the thing that I was telling you just a few moments ago, the poorest of the poor, when they get hit, they're not aware. They're not aware about, because they're already into this habit of chewing, the fibrosis has set in, and they don't even realize when it turns into a malignancy thing. Before it's so much advanced, then it kind of becomes a borderline situation, cure versus kind of palliation only. So that is the tragic part of it. Detected early, it's highly, highly amenable to cure. It can be very effectively treated. But once it crosses beyond a limit, beyond a stage, then obviously the outcomes will be kind of borderline. There will be loss of quality of life. There will be loss of years of life. So it's becomes a big problem afterwards.
Dr. Mysore, lately we've seen that the consumption of traditional tobacco products, apart from that, there is this e-cigarettes or the the alternate forms of consumption of smoking is there. How dangerous are these, or are they a good substitute for a traditional form of tobacco smoking?
The answer is obvious. It is obviously much more dangerous than actual cigarettes. Vaping and e-cigarettes. It was first introduced, brought up in China in 2016, e-cigarettes. And thereafter, it didn't take not more than 6 months to actually raise its ugly head in the States. Now, there has been first, second, and third generation e-cigarettes freely available everywhere and online markets. Now, the distinctive lung damage caused by e-cigarettes is called as VALI, V-A-L-I, and that is vapor induced acute lung injury kind of a term that is being defined. And this is much more dangerous. We do find the incidence of lung injury infections, especially during vaping, is very high. They get active spores, that is bacteria or fungus which is not in an active multiplication state. That stage is known as spore, and those spore formation is very much high in the vaping liquids. And there is increasing measures by all the countries and World Health authorities in trying to educate people about e-cigarettes and vaping, much more dangerous than the actual cigarette smoking. So we just can't choose between two of the evils. So it is better to stay away from all tobacco and e-cigarettes and the vape.
Got it. Dr. Gaurav, let me just come back to you. A lot of people assume that when they are going through certain depressing moments, anxiety, alcohol or smoking could actually provide some relief, and they take this as an excuse to take up these abuse. What happens that they feel relieved if there is any truth in this? And on the contrary, can smoking or tobacco consumption create mental health issues?
See, basically, we all have a right to choose what we want to do. Nobody can stop us for that. Definitely, repeatedly, once we are using alcohol and cigarette, we keep giving ourselves this message very, very strongly that it's a fun. Consuming alcohol is a fun. Consuming nicotine is a fun. And what they are participating is causing them a lot of high. they also see a society where alcohol and nicotine is commonly abused while they are relaxing, they are enjoying, or they are getting together. Now, if we see a lot of these hero models, movies, stars, parties, get together, these are the things which are commonly used. Now, one more thing which we are missing is a hookah. Hookah is also becoming these days very prevalent, especially in parties, and there is kind of a, again, role model, hero modeling following. Now, definitely because repeatedly we have given ourselves message, so we get a feeling that if we consume, we will feel better. Now, scientifically, there is no truth in that. Medically, there is no truth in that, but definitely psychologically, there is a lot of truth because repeatedly we have done that as a way of enjoying or way of relaxing. Now, lot of time smoking lead to medical issues, and that becomes a very much agony and painful. Like if I see a lot of medical fraternity, they are very well aware about the consequences of smoking, consequences of drinking, but they are not able to stop themselves because over the time, that is the kind of a thing they have reinforced. My message would be, it's very difficult to say what is the ideal approach to deal with the depression or difficult, stressful situation. But if we don't want alcohol or nicotine as a way of dealing it, we have to develop alternative ways and we have to practice them regularly, repeatedly, and then only we will develop new habits.
Dr. Anushil, there was a question that I had asked an earlier panelist, but the audio wasn't clear. I want to ask you that question, that what is the incidence of cancer being reported among smokers? So what percentage of smokers actually end up having cancer?
Okay, so this is a very important question, but then again, it's very difficult to exactly pinpoint because there are many factors that will influence this, including the number of years of tobacco use, including the quantity of tobacco use. But let me tell you that almost 50% of the tobacco users will be subjected to a disease or illness that can cost them their life because of tobacco use. So that's a very huge number. You cannot ignore that number. And obviously there can be mild modifications here and there on that number based on how much you are taking, how frequently you are taking. Are you mixing it with alcohol also? Because that is double trouble. You're taking alcohol and you're taking cigarettes, you're landing into double trouble. The same portion of your mucosa and other things are being subjected to these two together, which are having a synergistic effect. And that is really a lethal cocktail, I would say. So there are many factors that influence it, but more or less the message is very clear. Don't start smoking, and if you already started, stop it right away.
Sir, one of the things is passive smoking, and there has been a cultural change where we have seen that smoking in offices is not allowed anymore. Smoking in institutions is not allowed anymore. But then people go out on the street and smoke, or they start smoking at home. Have we seen a shift in people who are getting affected by passive smoking as to who's getting affected most now? And second is that, are they equally at risk, or there's a lower risk among passive smokers?
Now again, so you can have primary smoking, then there could be secondary that is emitted from the person and that's inhaled by someone, and there can be tertiary, for example, that is there in the walls or in the sofas. You go into a hotel, you are told, okay, it's a non-smoking room. That means there is no one who has been smoking there. So they're actually kind of a tertiary thing. So each of these is important, but obviously one who is smoking, the primary smoker, he's exposed to the highest levels of carcinogens and nicotine and other things. The problem is that, yes, secondary smoking also is problematic, probably a bit lesser compared to primary smoking, but yes, it is problematic nevertheless. It also is problematic because it sets a bad example in front of your family, your kith and kin, that here is my father who's smoking, so what's the big deal? I too can get on and have a puff. So for all these reasons, primary is obviously the worst, but even secondary and tertiary smoking, even they are bad and should be kind of avoided to the maximum level possible.
Dr. Gaurav, I want to ask you one specific question. That it's obviously when somebody has tried quitting to smoke and is unable to do that, that they resort to taking help and they come to a rehab center where they want to get over with this. Now, who are what brings them there? Is it, do they come on their own or are they forced by their family to be coming there? What has been your experience?
So I would say that, see, there are very few required to be admitted, because I feel that smoking normally is not that difficult to quit even outside. So very few who develop medical complications and they are not able to stop, they come for the thing of detox in a rehab. And definitely, if you see in India, there are very few rehab which are completely nicotine free. Most of the facilities, they have restriction in nicotine use, but there are availability. Now, the institution we run is smoke free, but I would not say nicotine free, because we use nicotine gums and nicotine sprays for the replacement therapy. So we try to alter the nicotine habits and we stop their tobacco chewing, non-smoking tobacco chewing, and then we stop their cigarettes, but we give the nicotine replacement therapy for helping them to overcome this. So most of them are, it's a combined approach where the patient, family, and doctor, 3 persons kind of encourage them, motivate them, or guide them that you do this will be helpful for you. But there are few times the family in a difficult situation when person is not cooperative and literally kind of a suicidal and smoking to kill himself, they decide to put them involuntarily into the rehab facility.
Got it. Dr. Mysore, what is very interesting is that Dr. Gaurav mentioned that smoking is stopped, chewing of tobacco is stopped, but it is substituted by nicotine, right? Now, is this less harmful or is it okay to have? What is your view on this?
So, sure, whenever you see a smoker, you need to follow the 5 A's: ask, advise, assist, and arrange, and look at whether they are peak seekers or trough seekers. That is, a person who wants to keep up the blood nicotine level subconsciously high will smoke at regular interval. There are office going lot who will smoke just before they head into the office, and the next cigarette will be barrage of cigarette when they come home. So they tend to be very smoke in private and in a clandestine manner. So when you assess the prescription of nicotine product substitute, that is either a patch or a gum, is based on actually typing out the individual whether he is a peak seeker or a trough seeker. Now, the whole point is nicotine coming through the smoke comes at 400 degrees Celsius and more with huge number of other byproducts. Even in second-hand smoke, which can be far more dangerous because you are not getting at a higher temperature, but the nicotine gets converted into codeine. And codeine is much more dangerous, and the particulate size is 2.5. So, in both the situations, active smoking is and passive smoking is far more dangerous compared to substitution by means of topical gum or topical through the skin. So yes, it will have effects, but I noticed that you had brought up the rewarding effects. So let us say somebody is upset in the office, they will storm off, go out, smoke, and come back in a slightly calm manner. There is a rewarding sense of hormones which Dr. Gaurav Gupta did mention about. So that kind of a response is getting nullified when you substitute the nicotine without the harmful effects of the high temperature first-hand smoke or low temperature second-hand smoke.
Right. So my next question to you is Dr. Anushil, and I want to ask the same question to Dr. Mysore also. So the harm of smoking and tobacco chewing is ultimately cancer, whether it is a lung cancer or whatever. And most of the time it's too late before you recognize that there is something wrong inside of you, which can be fatal. Are there any early signs that a person can look at which prompts him to go get a test done without, before it becomes too late?
So if you are talking about overall, so for example, in the case of lung, we have some guidelines for lung cancer screening for heavy smokers with more than 30 pack years of smoking, where a low dose CT scan is supposed to be useful for detecting early nodules done at a frequency of 1 to 2 years. So except for that, there is no firm guideline that, okay, you do this test every 3 or 4 months, for example, for oral area or in terms of scopy or something to prevent or early detect cancer. So that is why what is most critical is awareness. Awareness about what could be the early symptoms. Any abnormal bleeding coming, for example, while brushing teeth, any irregularity, because often we are aware about our oral cavity. And if the tongue feels something that is not there, that was not there earlier, it's better to get that evaluated. Any firmness, any irregularity, any ulcer that is not subsiding on its own even after 5, 10, 15, 20 days, or any kind of irritant throat thing that is going on, or a cough that is very, very irritant, unexplained weight loss and things like that. So these are the things one needs to keep in mind and report to a doctor early. It's very sad when even educated people who have these symptoms report to us at a late stage. And we wonder why even an educated person could behave like, but it happens in our society because probably some educated people are also not fully aware about when to go to the doctor early and why to go to the doctor. So these are the reasons one should report early, be aware, and try to detect the things early so that they can be treated and the patient can have a reasonable quality of life and reasonable life.
Dr. Mysore, would you want to add something to this?
Yes. So on the occasion of World No Tobacco Day, I would say we can all pledge and make a meaningful difference towards a tobacco-free world, which will be very gradual to see that picture emerge. And there are a number of ways. Why should we only look at lung cancer? The hardening of the lung, called interstitial lung disease, fibrosis as we call it, is much more deadlier. It doesn't let you live nor let you die. So far more horrible compared to some of the cancers. And there is no choosing one over the other. So what could we do is from the medical fraternity, and any common man can take up this 5 years, ask assess, advise, arrange for smoking cessation and assist them. Secondly, get the cue out. Whenever a smoking person who is desirous of quitting smoking, he sees, let us say, Clint Eastwood on the screen and he's smoking, that acts like a physical cue, and the urge to go out and smoke increases. So from the mainstream media, from the social media, I think smoking or scenes that are glorified with smoking needs to come out. That is from the media houses to give that kind of a commitment. Then early screening, as Dr. Anshul did mention, with respect to the lung cancer, you have the low-dose CT regular scanning, which was actually started as a study in Japan and later now a worldwide phenomena in early lung cancer detection. But there are a number of centers. I worked with the Queen Elizabeth Hospital, Adelaide, and they used to do this exhaled nitric oxide, simple test, exhaled carbon monoxide at frequent interval, and make sure people who are getting nicotine replacement are actually worthy of getting it free from the state health authorities, provided their exhaled carbon monoxide levels were very less. So there are a number of studies where early diffusion study, which is part of the spirometry, will show that yes, you are not heading towards that narrow slip between bronchitis and the irreversible COPD kind of a stage. So number of tools available, but not on a, I wouldn't advise it just like that. It should be through every general practitioner, every specialist, whichever branch of medicine or specialization, you should make an effort to advise your patients and look at the smoking cessation. That probably, I think, is going to be a long way towards early cessation of smoking. The distinction between when the deleterious effect starts is going to be a gray area, because the damage happens in the micro unit of the lung. Therefore, it takes, as I repeat myself, it takes 30-40 good years before the damage is complete. So every attempt we do to quit smoking at every office encounter is going to be fruitful. Thank you.
Got it. Dr. Gaurav, one very important question, because you brought up that a lot of people, in fact, you mentioned that almost 50% of the people who quit smoking in the short term, in the long term, get back to smoking again. What causes this? Have you been able to identify that? Why is it that people get back to smoking even though they have not smoked for a couple of weeks, 6 weeks, 10 weeks, and sometimes in 6 months also?
So basically in addiction, there are two clear phenomena which is known. One is the physical withdrawal, one is the psychological withdrawal, of physical dependence and psychological dependence. See, the physical dependence is a more short lasting where you have more withdrawal symptoms. But psychological dependence can be up to 2 years, 3 years, and even lifelong there is some phenomena. Like in particular situation, let's say I used to be a smoker in college, and after 10 years, I go and visit my college and I get tempted to have a cigarette. And that cigarette becomes a starting point, not the end point. Now, similarly, there are a lot of these kind of association, like with the constipation, like with the other medical issues where we feel that smoking can be a good relief. And we end up doing the same kind of a thing again and again. Now, I was also thinking during this whole discussion, see, we are thinking in terms of quitting at the very late stage. I think that quitting is not that late. The quitting should be started at very early stage on each and every exposure. While if I see one thing which can be very effective is regular exercise. Regular exercise de-stresses you. Regular exercise improves your vitals, improves your euphoria. breathing exercises can help you. They encourage you not to damage your body because otherwise you will not have the similar stamina. Now, I think if we can encourage a lot of our healthy population to go for exercise and not to expose themselves for the nicotine kind of a thing from the beginning, maybe we don't require to reach to an end point, we are forced to quit. So I would say as a mental health professional that we should encourage a population, a society where we are not exposed, or even exposed should stop and work on ourselves at the earliest. And doing simple exercise on a regular basis can give us a better phenomena or better reasons not to smoke. And I hope that that works better. Then we reach to a point where there is a medical complication like cancer or interstitial lung disease or something very bad, which leading us to quit. So I really want to promote a early intervention and more awareness in the childhood or adolescent than reaching to a adult or middle-aged population with the more complications.
I totally agree with you. I think it's a brilliant point because the best time to quit is when you're not addicted to it. So that will prevent a lot. Before I ask my last question, I have a request from the audience. I have a lady, Tanvi, who's there. She wants to ask a question. Tanvi, would you want to come on screen?
Hi.
Welcome, Tanvi.
Hi. Thank you, panel, for the insightful panel discussion. I have a specific twofold question, which is to the entire panel, specifically to Dr. Gupta. So I'll keep it short. I had a brain stroke in 2017, so it's a stroke in young case, and I was put on a smoking cessation program. So I've tried everything from loranges to patches to medication that blocks the nicotine receptors and everything. But every time I resume work, that's when smoking happens again because of the hectic work schedule, like Dr. Gupta pointed out, that psychological dependence. So for a person like me, one, what would you recommend in terms of going from addiction to de-addiction? And if that is not possible, are there any medication or lifestyle changes that can negate or maybe reduce the effect of continuous smoking? So that's my question.
So I would say, Tanvi, that thank you. And you are a typical smoker, not a atypical smoker. So most of us who have been into the habit of consuming nicotine are like this, that when they are in a little stressful situation, they end up repeating the same behavior. This is not particularly about smoking. A lot of us do these kind of things in eating habits also. They end up eating excessively. Their weight gain is there. They are not able to manage their schedule properly. And those kind of difficult situations and complicated behaviors erupt simultaneously. See, the first and the most important thing I would say is that we should not stop working on ourselves. We have to keep working. And even if you are smoking again and again, you have to keep making an effort of quitting. A thought that you need to quit itself is a first step towards the quitting than actually quitting. So if this is bothering you, if repeatedly you are being reminded yourself, you are surrounding, and I think that would be the first step. The second step is a lot of time we give up saying that I will not take any profession. I think it is worthwhile you go and talk to somebody. It cannot be a doctor or a counselor, maybe a simple somebody who is elder to you, somebody who has quit can be one of the help. Somebody, a guru, a religious leader can be one of the help. Maybe go to Gurdwara, go to temple, because somewhere the good thing is in our society, everyone is promoting that you should not be taking intoxicants. And that encourages us a lot. And maybe a regular reminder and regularly going there. Like I see a lot of patients do chalya, or they say, okay, we are not going to smoke or drink in Navratra. That is kind of giving them a strong foundation that if you can quit for 9 days, you can quit for the long term. Now, after this, I think the important thing is take help. Go to a professional who can work with you on your habits, on your addiction habits, and those things are very rewarding. We in society feel that we can do everything ourselves. We are not. Like if I have a heart problem, I need to go and visit a cardiologist. I can't treat myself. How can you treat addiction yourself? So if you take help, I think it would be much easier because there are a lot of medicine which can be used. There are a lot of things which can be used, which is very rewarding. So I think taking help is a much stronger step, bolder step than weaker step. So I would say that the effort has to be on, and normally there are 3 to 5 efforts which ultimately lead to a success.
Thank you so much. But that brings me to the second part of my question. So, like you said, I've taken a lot of help. Like, I went through this cessation program as well. I've tried hypnotherapy, I've tried NLP, I've tried almost everything that is triable. So, for people like us who are not able to move from addiction to de-addiction and are still struggling, are there any, like you were giving lifestyle changes and recommendations on exercising and everything? Are there any medications or treatments available that counteract the negative effects of smoking if one wants to balance the thing in
No,
the road of
see,
struggling to?
I'm not sure we can counter or we can rejuvenate our body, which is already being damaged. I cannot answer that, but I feel there are medicines which can help you to quit. And I said there are 2 medicines. One is bupropion, which is available with the name of Wellbutrin all over the world. And then second is Champix or Vernicillin. These are the 2 medicines which can help you to quit. I cannot comment that we have something which can help you to rejuvenate from the impact, whatever you have done, your damage, your body. I would say that for that, you need to have a better lifestyle, and that is the only thing which works the best.
Thank you. Thank you so much. Thank you.
I might add on that better support from the colleagues, workplace, avoiding queues, people who will be motivating at workplace. Those are some of the things. There are no absolute failures. One should be ready for smoking resumption in 6 months or so is an established fact. The only thing is concrete steps to take rather than abject failure or labeling myself saying I have not been able to quit despite A, B, C, D. So there is always, you can get lucky on the 5th attempt or 6th attempt. So wishing you all the best.
So don't give up.
Yes.
Yeah. My last question to the panel, and I wish to get, an answer from each one of you. In my opinion, I think the pandemic, apart from all the challenges that it created, all the, the negatives that happened, it has done 2 things when I think about smoking or tobacco consumption. One was that all of us have become a little more conscious about our immune system. We have become more conscious about preventive health rather than reactive. That's one. Second is, when people were locked at home, the 2 things happened. One, they were not getting access to cigarettes as easy as it was prior to the pandemic. Second was, they had their family members at home, so they were conscious about their passive smoking. So do you think, so my question to all of you is, do you think it has created some kind of an effect which has reduced the number of smokers? And second is, when you answer that, do also share in what, in your opinion, could be that bold step that you would recommend that will reduce smoking in the future? So let's
Can I start?
Absolutely, Dr. Gupta, please go ahead.
So I would say that, see, the bold step will not work, the education will work. We have to continuously nudge the population, encourage them to do something. And I would say that mental health impact of pandemic is being a very, very worse. So I see so many of my patients harming themselves to the extent that killing themselves. So I would say that stress overall or the mental health issues and problem following the pandemic has gone up exponentially high, and a simple nudge or simple education will work much better in a longer run than a shortcut.
Looking at the 1918 pandemic and there onwards, the effect of a pandemic lingers on for less than 20 years. The positive effect or negative effect. So in some areas, it has got some benefits that people may tend to continue to mask up. People may be cautious towards health and things like that. But these are some things that wane away. Therefore, I think whatever Dr. Gaurav Gupta mentioned, the need to have a continuous dialogue with the society at large, the need to look at smoking cessation at every encounter. These are some of the key mantras that are very much required. Thank you.
So I also feel it's a kind of a mixed bag. As you pointed out rightly, yes, around 15 or 20% of those who were smoking kind of became or dropped their smoking habits. But it is also true that some never ever smokers took to smoking because of several reasons, including depression, including loss of job, including poverty, thrown into poverty, and so on and so forth. Again, in terms of kind of overall medical awareness, it has produced a kind of a very unique situation because, for example, in my clinic, I often saw patients who had early disease, early cancer, and they came to my clinic later on when the COVID had waned, when their disease had actually progressed. So because of COVID, it's not that everyone became suddenly medically aware for all kinds of diseases. They actually perhaps focused their attention on COVID, even at the cost of serious diseases such as cancer. And they thought that we can wait, let the COVID wane off, and then we'll take care of other problems, because such was the kind of bombardment of messages that was going on. So it's a mixed picture. Hopefully, we are all medically aware, more aware now. That's what I hope and pray. And yes, as all of us have expressed the view, the key is education, awareness in all sections of our society. That would be the key message that we would like to give.
Thank you so much. You know what? This has been such a meaningful conversation. I'm so glad that we did this. And I really want to thank all of you from the bottom of my heart for taking out so much of time. I know we have gone overboard in terms of our timing, but it shows your commitment to help and contribute in the society, for taking this time out despite your busy schedules, OPDs, etc. My learning from today is that don't quit trying to quit. So that's the one thing that I learned from the question that the audience brought it up. So I want to thank you really from the bottom of my heart for taking our time for Business World, BW Healthcare. Thank you so much.